And I'm going to shut off my email so we don't have that going on. There we go. Hi there. My name is Christine Bennett, and I am the main field service manager with the Epilepsy Foundation. And we're very excited to have you here tonight for the introduction to VNS therapy for epilepsy treatment. And we have with us tonight Marissa from LivaNova to explain and kind of go over exactly the ins and outs of the vagus nerve stimulator and how that is such a great treatment option for drug-resistant epilepsy and all kinds of other things too that I know she'll be talking about and going over. So I'm actually going to turn over the presentation to Marissa so that she can go ahead and start, introduce herself. But welcome for being here tonight. Excited for all of you guys to be here to hear this amazing information. So without other point, I'm going to go ahead and change and go ahead and make you the presenter.
Thank you.
You're very welcome.
All right, let me figure out how to share my slides with you. Can you see my?
See them myself.
You can see yourself. All right, let's figure out how to.
I can see your screen. I can see your slides.
All right, perfect. Let me just minimize this here. All right, excellent. So my name is Marissa Bragdon. Thank you guys so much for joining me tonight. I really appreciate it. I am a nurse here in the Boston area, and my role is nurse educator with LivaNova. And LivaNova is the company that makes VNS therapy for epilepsy. So that's what we're here to talk about tonight. Prior to my role as a nurse educator with VNS therapy, I was working as an epilepsy nurse up here in Boston and then also down in Texas for a number of years. So I've been very fortunate to work with quite a few people along the way facing the diagnosis of epilepsy. So I'm hopefully here to teach you a little bit more tonight about a treatment option. Before we get started, I just want to thank Christine and the whole foundation for having me. I know you guys have been so hard at work with so many programs and supports during everything going on with COVID. So I'm very excited to be a part of this tonight. So Christine, is my volume okay? All right, we'll go for it.
Yep, you sound great.
Perfect. Okay, so I'm here today to talk a little bit more about VNS therapy as a treatment option for epilepsy. So I'm going to go through some slides to start. It's a relatively short presentation. So I'll leave plenty of time to answer questions if there are any at the end. And I'll give you some more resources as well. I'll give you my contact information and for our company and our website and all that stuff. So before I get started, I like to highlight that all the pictures in this presentation are of real people with epilepsy who decided that VNS therapy was the best choice for them. So there's a lot of videos on our website that tell the stories of these people. Unfortunately, technology, I just can't share the video in live time with you guys, so I encourage you to go check it out. But I'll tell you a little bit about the stories of a couple of these folks. So Johnny on the left here in the blue is an adult diagnosed with epilepsy. So his video and his story that he and his mom share on our website talks about how he was having quite a few seizures daily, lasting up to 45 minutes at times. So he decided VNS therapy was the best treatment option for him with his doctor. And he talks in the video about how much his life has changed since receiving VNS therapy. He's in college and just able to be a lot more independent. So it's a really nice story. Over on the right is Bella, and you'll see on her wrist, it looks sort of like a watch, but that's actually the VNS therapy magnet there. So I'll talk to you in a few minutes about more of what that is and what that does. But Bella was diagnosed with epilepsy when she was just a baby, and her parents share their story on our website as well. And they talk a lot about, in addition to the number of seizures she was having, she was struggling at school and with her memory as well. So after receiving VNS therapy, she's able to be a lot more independent, have sleepovers with her friends, and her seizures are greatly reduced. Her school performance has improved. She's playing sports. So things like that. They're both really, really nice stories. So I just always like to start with this. I think that real people can tell the story sometimes a lot better than I can. So So I encourage you to check those out, and I'll give you our website towards the end. So let's get started. Here's what we're going to go over today. So I'm going to talk a little bit about the basics of what drug-resistant epilepsy means. We'll talk about chances of seizure freedom with trying seizure medications. We'll talk about what VNS therapy is and how it works, and some of the potential benefits. And then at the end of the presentation, I'll leave plenty of time for questions, and I will give you some more resources and my contact info as well. So let's dive right in. So I'm going to start with a little bit of basics, and this may be review for a lot of you. I love giving webinars, so it's a little hard not to sometimes be able to be face-to-face with people and hear a bit more about their story. So we'll do the best we can all together. But 1 in 10 of us actually will have a seizure in our lifetime. So that's a pretty significant number. And 1 in 26 of us will develop epilepsy. So backing that up even more, a seizure is a disturbance in the electrical activity of the brain. So if anyone or anyone's loved ones on this line have ever had an EEG test, an EEG is monitoring that electrical activity, and we all have that at baseline in our brains. So a seizure is when those electrical signals get sort of scrambled up and that pattern is changed. What epilepsy means is the tendency to have repeated seizures without something very specific provoking them. There's like a couple of medical conditions and stuff that can do that, but epilepsy means the tendency to have repeated seizures. Some people also use the word seizure disorder to describe epilepsy, so those two are the same thing. The seizures in epilepsy can be caused by a number of different things. So things like a genetic diagnosis or metabolic disorder, and also things like a brain tumor or a brain malformation, or perhaps a brain injury. So they can be caused by a lot of different things. But very often, despite the number of tests that we're able to do, like MRI scans and genetic testing, we're not always able to determine the exact reason for a person's epilepsy. So this can be very common to not know the exact root cause. About 3.4 million people in America live with active epilepsy. So that's in that blue box over there on the left. So that's quite a few people that epilepsy affects in our country. When a person is first diagnosed with epilepsy, I'm sure many of you are familiar with this as people with epilepsy yourselves, or perhaps caregivers and loved ones on the line. The first treatment is typically medication. So this is what we call an anti-seizure medication. So that's typically where we start when a person is diagnosed with epilepsy. So for just under half of people, I'm going to point to these numbers down on the bottom right of my screen here. So for just under half of people, about 46%, their seizures will become well controlled under the care using one seizure medication. So about 46% of people will become seizure free on that first medicine. If a person continues to have seizures despite that medicine, then their doctor often tries a second medication. So this adds about 12% more of people who will become seizure-free with that second medicine there. By the time a person is trying their third medication, meaning they've tried 2 medicines and are still having seizures, and their doctor determines that a third medicine is the next step, that number drops quite a bit. So there's only about a 5% chance that they will become seizure-free trying that third medicine. So what all of this means is that about a third of people with epilepsy have something called drug-resistant epilepsy. And drug-resistant epilepsy is essentially a fancy way of saying that someone has seizures that are continuing despite trying several medicines. So over the last 30 years or so, despite quite a few new seizure medicines coming onto the market, and a lot of those work in several different ways, this 1/3 number, about a 1/3 of people with epilepsy that fall into this drug-resistant population, that number has not changed. So about 1/3 of people still continue to have drug-resistant epilepsy. So what does that mean? especially for the people that are continuing to have seizures and have drug-resistant epilepsy. So this is usually when their doctor starts to talk about other options. So this might mean a referral to an epilepsy center if that hasn't been done yet, or seeing a specialist that treats drug-resistant epilepsy. This might mean a workup to determine if they're a candidate for epilepsy surgery or perhaps a dietary therapy. And also there's this category of treatment called neuromodulation, and that's a fancy word for saying sort of medical devices like VNS and RNS and DBS that can help treat drug-resistant epilepsy as well. So these options then become a bigger part of the conversation. So what is VNS therapy? VNS therapy stands for vagus nerve stimulation. So the vagus nerve is a nerve in our neck. And VNS therapy is a small implanted device that's designed specifically for people with drug-resistant epilepsy. And I'm going to show you in just a minute what it looks like. And I have a little demo here too I can show you. So it's approved as an add-on therapy for people over 4 years of age with drug-resistant epilepsy that have partial onset seizures. And I'll talk more about that in a bit, but VNS therapy has been around for a long time. So it's been used in more than 120,000 people and 33,000 children as well. So quite a long time, quite a lot of people. Some people describe it almost like a pacemaker for your brain, and I'll show you that might make more sense when I show you a picture of what it looks like. The goal of VNS therapy is to prevent seizures before they start and to stop them if they do. So I'll break it down sort of into the different functions of how it actually works in just a minute. So this slide highlights some potential benefits that a person that decides on VNS therapy may receive. So again, the goal is to prevent seizures before they start and to stop them if they do. So many people receiving VNS therapy experience fewer seizures and shorter seizures. So again, that's our goal here. This benefit tends to improve over time. So over the number of months and actually years after a person receives VNS therapy, this can continue to improve. Many people experience improvements in their quality of life after receiving VNS therapy. So this includes things like alertness and mood and memory. I like to highlight this in my patients that I work with VNS therapy, but it's also our device, the same device is also approved by the FDA for treatment-resistant depression. So people that are receiving this therapy for epilepsy also get the added bonus that it can improve your mood and your attention and your alertness as well. Fewer healthcare emergencies and costs. So this could be significant for a family and for a person. So perhaps you or your loved one have had a prolonged seizure and been in the emergency room, or a fall with a seizure that needed a hospital stay. So these things could be decreased with the use of VNS therapy, and with the goal again being if those seizures are under better control and shorter, then perhaps those healthcare emergencies could be reduced. SUDEP risk does decrease in long-term follow-up of patients with VNS therapy. And then over here on the right, these are some other benefits. So decreased seizure intensity and better recovery after seizures. I hear about these quite frequently with my patients, but Bella's family highlights this in their video on the website. So they talk about how her seizure recovery used to be quite long after her seizures, and now they just see a quick blink and she's able to go back and participate in her life sooner. So this can be a pretty significant thing for families. So I like to use an example to kind of put this into better perspective. So pardon my math, it's a little late in the day. I picked a simple number to go with. So let's say a person is having 2 seizures a month. So that equals 24 seizures in a year. And after they have a seizure, they need to rest for the rest of the day. And then, perhaps the next day they're feeling a little groggy or may have a headache or need some time to recover then. So that's about another, if you count those recovery days, we're talking, you know, upwards of 40 days a year that they're losing to seizures and recovery. So this can be quite significant. So what if that number was cut in half? So let's say instead of 24 seizures in a year, it's 12 seizures. Or what if that recovery time is less? So instead of needing a whole day to recover, perhaps it's only a couple of hours and they're back out and living their life. So just some food for thought there. No medication related side effects. So I always like to highlight this because VNS therapy works different than medication does. I'm sure most of us have taken a medication that we've had a side effect from, and seizure medicines can have an especially tough side effect profile. So VNS therapy doesn't work like a medicine. So I'll get back into a little bit of side effects as we move on, but it works very differently. And then lastly, VNS therapy can be used with medicine and other treatment options. So it very commonly is used with medicine, and I like to set that expectation up from the beginning that most people who receive VNS therapy do need to continue taking their seizure medicines, but that doesn't mean that perhaps a dose of their medicine couldn't be reduced or that one of their multiple medicines couldn't be reduced. That's completely up to the doctor. Receiving VNS therapy certainly doesn't mean that a person wouldn't be a candidate for brain surgery or for dietary therapies or for trying a new medicine if they needed. And also conversely, many of the people I work with that receive VNS therapy decide it's right for them, perhaps after they find out they're not a candidate for brain surgery, or if they have had surgery and they're continuing to have seizures, or have tried the diet and are not happy with their current seizure control. So those things work sort of conversely. All right, so let's talk a little bit about how it works and the procedure itself. So there are two parts to the therapy. The first part is called the battery or the generator. And that's that little silver thing that you see in the chest there. And this, I don't know if you guys can see this, it's probably quite small, but this is what it looks like. So it's pretty thin and pretty small. This is our newest device. The little squiggly line that you see in the chest and the neck there is called the lead, or it's sort of like a wire is a fancy way to word it. So both are implanted right under the skin, and they're put in a short outpatient procedure. And by short, I mean typically about an hour, 60 minutes of a procedure. Most people are able to go home the same day. And I like to word this sort of like, if you think about it, you go in first thing in the morning, usually those mornings are pretty early, but typically most people are home by the afternoon in time for a late lunch. VNS therapy is not brain surgery, so I want to highlight this. There's no craniotomy or opening up the skull, exposing the brain, none of that involved. It's all just here in the neck and chest. So the generator or the battery, that silver part, is just placed sort of in the fatty tissue of your chest right here. And then the wire is sort of wiggled up and it's placed around the nerve, that vagus nerve in your neck. These loops are here just to give the wire a little bit of extra room. So as you move and grow, it has plenty of room in there and is comfortable. So basically how it works is that gentle stimulation is delivered from the battery, so here in the chest, up the wire and onto the nerve. And I want to highlight the word gentle here. So many people can feel the stimulation, but it should never be uncomfortable or painful in any way. There are many different things that your doctor can adjust on the setting. So the goal here is that you may feel it a little bit, but it should never be painful or uncomfortable. There are two small incisions that are involved in the actual procedure itself. So one incision in the neck, and a lot of the surgeons that I work with do a really excellent job. We all have some natural kind of folds in our neck anyways, of sort of tucking that in somewhere. But you could certainly talk to your doctor if you had any concerns about these little scars. And then there'll be a small incision in the upper chest as well, so where the actual battery itself goes in. The battery typically lasts between 5 and 10 years, and this just all depends on how your doctor sets the settings just for you. And I do get asked quite a bit about what happens when the battery starts to get low and needs to be replaced. So as long as the little lead, that wire in your neck, all of that part is working just fine, the procedure is even quicker. So your doctor, it will be done another procedure, but it's even quicker. So it's just that one incision down there, the old battery is taken out and the new one is put in. And again, typically home the same day and hopefully recovering quite quickly from that. All right, so let's get into the nitty-gritty about how it works here. So typically, the person that is implanted with VNS therapy is seen by their surgeon and their doctor a couple of weeks after the device is placed, and it's turned on then. And the reason we do that, and all doctors do this a little differently, but one of the reasons we do that is just to allow you some time to heal. You'd go into your doctor's office and the device is turned on, and the settings of it are slowly increased, usually about every 2 weeks, until what we call a goal dose of therapy. So you're getting into that target range of therapy. Kind of like how, if any of you have ever tried a seizure medicine that is slowly increased over time, there are quite a few that work that way. Again, VNS therapy isn't a medicine, but I just like to compare kind of that low and slow technology with how this works, because it does take a little time to get those settings where we like them. All right, so many people do experience a quick benefit, but it really can take a couple of months to start to see those results. So I like to set that expectation ahead of time so that, we don't think that this is a complete failure if within a week, the person's seizures haven't drastically changed. It's going to take a little time, and it's going to take a little time for those patterns in the brain to reset and all these things to change a little bit. So there are also quite a few settings within the device that your doctor can customize just for you with the aim of getting the best seizure control possible. So these are the 3 different ways that the device works. So first is what we call standard mode. And this is sort of like prevention. It's sort of like taking your seizure medicine every day. Again, not a medicine, but it's like a medicine you don't have to think about. So basically what this means is your doctor sets that gentle stimulation to go on and off at regular intervals throughout the day and night. So the goal here with this prevention delivery is to stop seizures before they start. So this typically looks like a number of seconds of the device being on, that stimulation being on, like 30 seconds or so, and then a couple of minutes of it being off. So 3 minutes or 5 minutes, whatever your doctor decides is best for you. So it's cycling on and off, just while you live your life, while you sleep, everything like that. So again, the goal with this type of therapy, this part of the therapy, is to stop those seizures before they start. The next part, and this is in our newer models of VNS therapy, is what I call the detect and respond mode, or responsive therapy. So how this works is a lot of people, when they begin to have a seizure, their heart rate does quite a rapid jump. So what our responsive delivery is always monitoring the person's heart rate in the background. And when a rapid increase of that heart rate goes up, and this is not like when you take off for a walk or a jog or anything like that, this is a pretty quick jump, an extra dose of therapy is automatically delivered. So a seizure may be occurring if that heart rate leaps up, and an extra boost of that therapy, an extra dose, is delivered automatically. So nothing you have to do. And the goal here is to be stopping a seizure if one is starting. All the way to the right is what we call magnet mode. And all of these work together in the VNS therapy device. So magnet mode is the on-demand delivery of the therapy. So basically, when a person receives VNS therapy, we send them home with a very strong magnet, actually a little set of 2. And if you remember back in the beginning, I pointed out that Bella had hers on her wrist. So it looks just like that. It looks sort of like a watch. So what the magnet mode essentially gives you or your caregiver, or if there are any parents on the line, you as the caregiver, the ability to deliver an extra dose of therapy if a seizure or an aura were occurring. So if you have epilepsy and you experience an aura and are awake and alert enough to be able to swipe the device yourself, you just use the magnet and swipe it right over where it is in your chest, and it gives you an extra boost of that therapy. Or caregivers can certainly do this if a seizure were to occur. And the goal here is to stop a seizure if one were starting, or to reduce the amount of time or the severity that it's lasting. So I hear from a lot of families that I work with that the magnet gives them a little bit of peace of mind and a little bit of a way to help their loved one when a seizure is occurring, because seizures are scary. And when the seizures are occurring at times, they can last for those seconds can feel like hours. And so as a caregiver, to have something to be able to do can, be a little empowering. Or if you're the person with epilepsy and you feel that aura and can give yourself an extra dose, then hopefully this could make an impact in your seizures as well. So that is a little bit more about how it works. All right. So ultimately, your doctor would be the one to decide which VNS therapy device would be right for you. So I just want to highlight some of our latest sort of parts of the newest device here. So what I really want to highlight is the personalization that this allows. So your doctor can totally customize all the settings in your device to decide what would be best for you and your treatment plan. So one feature I like to highlight is something called day-night programming. And what day-night programming does is essentially allow your doctor to program your settings based on the time of day. So if they feel as though you need more or less stimulation during a certain time, doesn't have to be day and night, then they can set all of your settings special for you. The second thing I like to highlight is what's called scheduled programming. And scheduled programming has gained a little bit of popularity with some of the doctors I work with during this COVID crisis happening right now. Because what scheduled programming allows you to do is you would, instead of needing to visit your doctor's office every 2 weeks for a couple of months for those settings to be slowly increased, your doctor could set a schedule. You'd need to go in once, and your doctor could set a schedule for those changes to automatically occur while you're at home. So if we can certainly reduce the need for anyone to be exposed to germs, and while it's a little bit trickier to schedule appointments at a doctor's office right now, this can be another helpful thing for many people with the therapy. All right, I want to touch on side effects. So like I mentioned before, I think most of us have probably experienced a side effect from one medicine or another. And again, some of those seizure medicine side effects can be especially intense. So I want to highlight that VNS therapy is not a medicine. So it doesn't cause medicine-related side effects. Medicine-related side effects stick around until the medicine is totally out of your body. VNS therapy does have some potential side effects, but they don't work like medicine side effects do. If they occur, they only tend to occur when that gentle stimulation is going on. So in that number of seconds or however long that the device is actually on. The other thing about side effects is they tend to decrease or go away over time. So some of the most common side effects that some people experience would be some hoarseness of the voice, sometimes a little bit of a sore throat or a cough, and shortness of breath can occur too. I've had patients describe this to me almost less of a shortness of breath, like if you're like me and when you take off in a jog, but almost like a quick little gasp or like a breathlessness for a second when that stimulation turns on, but everyone can experience it differently. So again, I do like to highlight that these only tend to occur when that stimulation is going on. They really do tend to improve over time. And we never want the stimulation to be painful or uncomfortable. So again, there are many different things that your doctor could customize in your device if you were experiencing side effects that were intolerable. And the other thing I like to highlight is the magnet, that magnet that can give you an extra boost of therapy can actually be used to temporarily turn off the therapy as well. So let's say you have a singing event, you're singing in a choir, and if you were to be experiencing a little hoarseness of your voice with the simulation, what you could do is use the magnet and tape it or sort of put a wrap around right over your VNS device, and it temporarily turns the stimulation off. So you could do your performance and then remove the magnet right away, and your therapy would go back to right where it was. So it's another good option for people as well. Infection is the most common side effect of the procedure itself. Of course, infection is always a risk anytime there's a procedure. This is a very small risk, and I would really encourage you to talk to your surgeon if you had any concerns about the incision or the placement or infection, and they can tell you a lot more about what their plan would be. I also like to mention now MRI compatibility. I think MRI sometimes can be a little confusing. So all of our models are compatible with an MRI of the brain, but we do need to follow some special precautions when an MRI occurs. So it's important if you have a VNS device to talk to your doctor about that, and we'll make sure that we follow those special guidelines. But tests like X-rays and CT scans and ultrasounds are also all safe with VNS therapy. All right. So this is a nice summary slide that I like about VNS therapy. So I really ultimately encourage you or your loved one to talk to your doctor about your options if you guys are facing drug-resistant epilepsy. So remember, by the time that you're trying that third medicine, the chance of becoming seizure-free is only about 5%. So while VNS therapy isn't a cure, it's a treatment that really may be able to make an impact on your seizures, the recovery time, and ultimately have a positive impact on quality of life. It's also a treatment that you don't have to remember to take every day. So it's just always on, it's there, it's doing its job while you go about your life. This is some safety information about the device. It's also all on our website on vnstherapy.com if you'd like to learn a little bit more. I'm going to skip this and come right back to it. So I want to finish by showing you some additional resources that might be helpful. So first, I want to highlight, if you're looking for general epilepsy information, treatment information, resources, the Epilepsy Foundation is the gold standard in regards to this info. So please check out their website and don't hesitate to reach out to someone from the foundation if you need resources or support as well. Also, talk to your doctor. That's a great place to start if you would like to learn a little bit more about VNS therapy. Down here on the right is our website, so that's vnstherapy.com if you're looking for VNS information. So a ton of good info on that site. Again, the videos that I've been referencing are there, and there's quite a bit that you could learn from there. The number on the bottom right is the number to our case managers, and case managers are nurses just like me. So they wear a number of different hats for us. So they really are here to offer support and have a lot of training about VNS therapy. So they can certainly answer any questions that you have. If you're interested in finding a doctor, if you don't have one right now, they could assist with that. Insurance questions, and then also connection. So helping to connect you to someone else who's using VNS therapy. Sometimes that's the best way. It's just, you know, I can talk to you about it forever, but to talk to someone else who's experienced it firsthand can be really helpful. So I encourage you to use any of these resources if you are interested. I also want to give you my, here I am, this is last summer, I had a very nice tan here, but this is my information right here. So I am a nurse and I work in the Boston and Rhode Island area, but we do have, if you guys, if anyone on the line is in a different state, we have a whole great team in New England, and I will help point you to the direction and get you in touch with someone specific to where you live. So my phone number and email are here. And if you have any questions or you want to talk more, please don't hesitate to reach out, and I would love to speak with you. And we can make sure, I can go back to this at the end or make sure you guys get it, so don't worry. All right, so let me go back. and open it up for questions. Does anyone have any questions or anything that I can answer? Christine, are we able to open up a conversation for questions?
Yeah, most definitely.
I don't know if it's easier, if there's a format and people can type them in or whatever works easiest.
So people would have to unmute themselves. And I've gone ahead and unmuted everybody so on my end. So they would just need to go ahead and unmute themselves on their end to ask a question. Also as well, after this program, I can also be more than happy. I know, Marissa, I can share if you have a question after the program. You're more than welcome to reach out to me, and I'm more than welcome to get you in contact with Marissa if you have more questions. Sometimes I know that listening to the information, having all of this information coming back to you all in this huge piece can sometimes be overwhelming, and trying to process that information, and then you go about your day or the rest of the night and you think, wow, I wonder if this, or I wonder if that. So please don't feel that just because the webinar is over that the questions can't continue. So please reach out to me as well. Susan Welby is another go-to person as well for information, but we're here to support you guys, and I'm definitely here. If you have any more questions, I can definitely get you in touch with Marissa directly to help with any of those questions as well.
That's excellent. Thank you. And yeah, I know this is a lot of information. I tried to cover as much as I could so everyone could get an understanding of the basics, but this is a lot. So the most important thing is take your time and think about it. Learn more through questions and some good resources and things that you need. And that's exactly right. I always say, write down your questions. I keep a little pad of paper in my purse, to be honest. And sometimes I just jot things down so I can remember to bring stuff up when the time is right. So don't hesitate to reach out if there's anything I can do to help.
Exactly.
Does anyone have any questions that I can help with? I'll cover a couple of ones I get all the time. All right, well, I'll answer a couple that I get asked quite frequently. So insurance is often a common one. So most insurance plans do cover this. I would suggest reaching out to your doctor and working with them, as well as your insurance plan directly. And like I said, we do have some resources within VNS Therapy that we could use as well if insurance was a concern. Our case managers are quite experts in that insurance process, but I would start with your insurance company and your doctor. What else? I wrote down a couple that I get all the time here. Let's see. I touched on medication. Can I go through airport security? This is actually a very common one. So yes, you can. When you're implanted with VNS Therapy, we give you a little implant card that you could carry with you and just identify that you have the device. So you might want to request, the sort of private security screening if you wanted to, but it's absolutely safe, and we'll give you an ID card so you can have that with you at all times. Let's see.
I had a question.
Sure.
So what's like the most frequent complication, I guess, you see with VNS placement, and like what percentage of patients, like do you have any patients that ever get it taken out because of such like severe adverse reactions?
So the number one thing that can happen is what I mentioned with infection. So that is the most common complication, and that's a surgical risk. So it's the same kind of thing. Like anytime we were to have a procedure, there's always that risk of infection. So that tends to be the number one thing. I don't know the actual percentage, but I know it's quite small, like single digits, small risk. But that would be a really good question for if you were moving forward and wanted to meet with a surgeon about what that number more looks like at their office. In regards to getting it removed, it certainly can be removed if a person wanted to go down that route. typically there's a lot of things that we can do with the device and the settings if a person were feeling as though they weren't getting as great seizure control as they were hoping. So we do like to, you know, sort of have a look at the settings and make sure that that we're maximizing all the things that the device can do. But yes, it doesn't have to be a permanent thing. If for whatever reason it needed to be removed, it certainly could.
Thank you.
Yes, good question.
The other thing too that I can offer as well, that we have several individuals that we know who've had who have a VNS, and I know for a fact we'd be more than happy to connect with somebody and kind of talk about their experience and what they've been through and how it's helped them. Also can talk about the pieces that, you know, they struggled with too. So all of the good in with it as well. And those questions I know that come up. So, you know, you can definitely reach out to me, Christine Bennett, at the Epilepsy Foundation New England, and I'd be more than happy to connect somebody with somebody else who has a VNS and maybe could help. Sometimes just talking to somebody else who's gone through the procedure makes a huge difference.
Absolutely. That firsthand experience is so important. And like I said, I can teach about it, but to talk to someone who has such personal experience is really great. So thank you so much.
No, of course.
Any other questions at all? Anyone else? Okay. Well, if anyone would like to reach out, again, please don't hesitate to reach out to Christine with your questions, or if I can assist with anything, she can forward them right along to me. I really want to thank you all for taking the time to spend a little bit of time this evening with me, and hopefully you learned a thing or two. And again, I encourage you to talk to your doctor if you're interested in learning a little bit more. So thank you so much.
Exactly. Well, thank you so much for everybody being here tonight. Again, if you have questions or anything else that's coming up that you didn't think about during the presentation, and again, if you're going on later on and thinking about something, please reach out to me, and I'm more than happy to connect you with whoever you need to be connected with, and can definitely help answer any questions that you have. So thank you for everyone being here. Marissa, thank you so much for spending your time with us tonight and sharing all of the wonderful information that you gave to our families. So I want to wish you a wonderful night for everybody. Hopefully you get out to get I don't know where, I'm in Maine right now, so we had a little cloudiness, but it was a nice day to get a walk out and stretch our legs. So thank you to everybody that was here. And again, thanks, Marissa. And I want to wish everybody have a wonderful night.
Thank you. Thanks for having me. Take care, everyone.
Thank you.